Infections, injuries, and certain ocular diseases can cause a corneal scar. While severe scarring can have an impact on your vision, some scars don't affect vision at all. It all depends on where they are located and what caused them. Severe scarring can distort your vision and cause light sensitivity, so they need to be monitored closely. There are different treatments that can be done for corneal scarring. In some cases, specialty contact lenses such as scleral lenses can help. These specialty lenses sit on the white part of the eye, or the sclera, instead of the cornea, and allow the eye to have a more regular shape, covering up the distortions from the scar. In other cases, a laser surgery called PTK can help with scarring, and in the most extreme cases, a corneal transplant may be the best solution. If you do injure your eye or have a scarring as a result of a medical condition, it is important to keep your eye exam appointments so that we can watch things closely and make sure we choose the best approach for you.